Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honorable Andrew Furey, Premier of Newfoundland and Labrador, the Honorable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, February 24th, 2021. I'll turn things over now to Dr. Fitzgerald for her update.
Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have 8 new confirmed cases of COVID-19 in our province, all in the Eastern Health region and under investigation. There are 3 under 20 years of age, 4 between 40 and 49 years of age, 1 between 50 and 59 years of age, and the total number of cases in our province is now 963. Today, I'm very sad to report that a person has passed away due to COVID-19 in the Eastern Health region. We extend our sincere condolences to the family at this difficult time. This is the 5th COVID-related death in the province. There have been 34 new recoveries in Eastern Health. leaving 345 active cases in the province. There are no new or outstanding presumptive cases. 6 people are in hospital due to COVID-19. 636 people have been tested since yesterday, for a total of 110,176 tested to date. We are seeing our confirmed and active cases dropping, as well as the number of individuals tested. I caution everyone not to let the smaller case count lead to a false sense of security. COVID continues to circulate in the community. Remember that behind each positive case is a group of contacts that need to be identified and tested. As other provinces begin to reopen, they are seeing an increase in cases. As long as the variant circulates outside our province, it will make its way back into our province. This is a certainty. This means we are always at risk for another outbreak if we don't remain vigilant. When the time does come for us to ease restrictions, it will not mean that we can relax our personal interactions. It means, in fact, just the opposite. Bringing society back to a level of functioning we saw prior to this outbreak will mean we will have to be more attentive than ever to our personal protective measures. For now, as we all continue on in Alert Level 5, remember your layers to protect yourself, your family, and your community. Only enter indoor public spaces if necessary. Keep your contacts to your household bubble. Wear a mask and ensure 6 feet of distance when interacting with people who are not in your bubble. And wash your hands or use hand sanitizer when entering and leaving public spaces and when returning home. While the majority of individuals with COVID in our province have experienced mild or even no symptoms, it has the potential to cause severe illness in some individuals. Remember that we have 6 people in hospital right now due to COVID severity, as well as a family that has lost their loved one. Please keep them in your thoughts. Each life lost is a tragedy, as well as a stark reminder of why our way of life has changed. In some good news, we are hopeful the delays in vaccine shipments from the manufacturers are largely behind us. Regional health authorities are administering to Phase 1 priority groups as quickly as possible. We expect that some regions may move through their priority groups more quickly than others due to factors such as geography and demographics. In keeping with the evidence, our focus will continue to be on those most at risk for severe disease from COVID-19 and those healthcare workers involved in COVID response. We will release our Phase 2 and 3 vaccine plans on Friday. As a recap, for those who may have just joined us, we have 8 new confirmed cases since yesterday's media advisory, and the total number of cases in the province stands at 963. Today, students and administrators across our province are celebrating Pink Shirt Day, promoting kindness and respect. Let's take this cue from our children and youth and be compassionate in our interactions with others, both strangers and friends. We can never truly know another individual's circumstances. During these times of uncertainty, when our patience and resolve are in short supply, remember that the power of kindness will help see everyone through this. We are almost a full year into the pandemic, and while it seems that it will stretch on forever, it will not. One day we will be able to gather together and hug our friends and family. And until that time, we must hold on to what we do have: love, positivity, kindness, and hope. So hold fast, Newfoundland and Labrador. Thanks.
Well, thank you, Dr. Fitzgerald. All of our thoughts are with the family of the person who passed away. Dr. Fitzgerald, Dr. Haggie, and I know that a death under any circumstance is never easy. A loss of life is always a sad day. To the family and friends of the departed, you have our sincere condolences. It seems the cruelty of loss is compounded by the inability to properly mourn because of the restrictions. Please know that the entire province mourns with you. This moment reminds us of the spectrum of the effect that this virus can have. For some people, it presents as mild symptoms. Others will recover at home with stronger symptoms. Then there are those where hospitalization is required and the situation can be serious. This is the very reason why Dr. Fitzgerald and her team have taken the measures they have to contain and stop the spread of this virus, especially this contagious variant. This death also reminds us why vaccination is so important and critical to ensure that we protect the most vulnerable, for seniors, for Indigenous communities. And everyone at home, you still need to continue to do your part in the meantime. Strictly follow all the COVID-19 guidelines. Respect the bubbles. Stay home as much as you can. Today we think of the other people in hospital and we hold them tightly in our thoughts and prayers. While this is a sad day for the province, we cannot lose hope. Our case numbers are down, our recovery numbers are up. We will get through this. We are getting through this together. With that, I'll turn it over to Dr. Haggie for a quick update.
Thank you very much, Premier. Day 353 and another sad day, and I would echo comments from my panelists about sending condolences to the family in these difficult circumstances. We have 8 new cases and 34 recoveries, which leads to a decline in the total number of active cases. And we've also seen a significant decline in the number, for example, of healthcare workers who are in isolation currently. Total across the province now is down to 312 from its peak of last week. I would like to amplify some of Dr. Fitzgerald's comments about vaccine, as there seems to be significant to and fro about numbers. So, in a snapshot, on Friday evening, we had delivered 97% of the Pfizer vaccine and actually administered it into patients as of that evening. We get a delivery, and the following morning, having changed nothing else, that goes down to 68%. So when you get your percentage depends on when you do your sums. That 6,000 is currently going round the province to rural and isolated communities to complete what I think might be a better metric, which is how we're measuring up with our targets under our vaccination plan of phase 1, which was guided by NACI, the National Advisory Committee on Immunization. So by Friday of this week, when we anticipate another delivery from Pfizer, by Friday of this week, we will have administered a vaccine to every resident of long-term care in this province who wanted it and who is eligible. By the end of this week, with regard to phase 1 essential healthcare workers, everyone in Labrador Grenfell will have had at least 1 dose. By the week's end, by Friday, we will have had everyone in Western and Central Health who falls into that category with a vaccine in their arm. And by March the 5th, Eastern Health will have done all of their rural essential workers in addition to their metropolitan ones. The next group of at-risk individuals that we referenced are seniors. We will be starting across the province with seniors over the age of 85 at registration on March the 2nd in Central and Western. The Indigenous communities in Labrador Grenfell have already had everyone over the age of 75 having at least 1 dose. And on March the 1st, the rest of Labrador Grenfell will be in the fortunate position of going to offer that same thing to people over the age of 75. So in terms of vaccine deliveries, which has always been our concern, we have no guarantee of any supply in March at all from Moderna as yet. With regard to Pfizer, they have guaranteed us approximately 6,000 doses per week. In addition to that, they have also promised 80,000 extra over the course of March. In addition to that, they have also promised 249,000 extra doses over the course of the quarter ending at the end of May. Those last 2 quantities we have not seen hide and hair of as yet. But given the comments on the national scale, we're hopeful, optimistic that we may see some or all of that, in which case we have a plan to ramp up vaccination in the way we did with the flu shot and to use anybody whose scope of practice allows them to safely give vaccine if that is not enough. So I think I'd just like to try and emphasize that. Dr. Fitzgerald has referenced the rest of phase 2 and phase 3 for the vaccination plan will be published on Friday. And I think I would just like to close again by emphasizing that we should be trying to spread kindness, particularly on Pink Shirt Day, and not COVID. And with that, I would pass it back to you, Premier, for the rest of the event.
Well, thank you, Minister. I'll now open it up for questions.
Thank you, Premier. For the benefit of our speakers, there are 8 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Richard Duggan with VOCM. Please go ahead.
Well, thank you and good afternoon. Dr. Fitzgerald, you revealed a little while ago that our vaccination plan for phase 2 and 3 will be released on Friday. We've heard numerous concerns from people about vaccine priorities. Just wondering if you could speak to how comprehensive of a plan will this be, and how well do you believe it addresses some of the many concerns that we've heard?
So the first thing we have to remember with any of our vaccine plans is that they are contingent on supply. And they're also contingent on recommendations with regard to dosing intervals and dosing schedules. So we have to bear that in mind. As of right now, I think, the information that we have in this plan will be able to give people a sense of where they fit in that plan and allow people to sort of govern themselves accordingly. But I think people will be able to see where they fit.
Thank you. And there are a lot of questions circulating about the situation at St. Clair's. Eastern Health got back to VOCM News a little while ago and stated that for privacy reasons they couldn't provide specifics on the spread there. What specific information can you tell us about what's going on at St. Clair's? As I'm sure you can appreciate, there's lots of worry out there about spread within the hospital and the implications of that.
I'll take this one if nobody minds. There is no outbreak at St. Clair's. There are cases of positive patients with COVID who in actual fact were admitted for other reasons than COVID. The method of how they got the disease is not clear for some of them, and it's still currently under investigation. It is, however, contained. There's been no evidence from public health or infection prevention and control of any escape, and there is no outbreak at St. Clair's. And I think that latter is really important to emphasize so that people have confidence should they need to visit St. Clair's as patients or for urgent services.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I've got a question about schools. For a week and a half, we've been trying to get a list of which schools have had staff or students that have tested positive. Eastern Health has told me there are 22 schools, but is refusing to name them. Other provinces post this information routinely online. So, Minister Haggie or the Premier, whoever wants to, why shouldn't parents know which schools have had positive cases?
Certainly, I know of the list, Peter. It was prepared by Public Health and Eastern Health. My understanding it is with the school district who wish to do some consultations with internal stakeholders before any further steps are taken.
So we've had more than 100 students, and according to my sources, more than a dozen teachers at Mount Pearl Senior High who've all caught the virus. What does this say about the measures that are in place at schools, and what changes are going to need to be made before in-person classes resume to make sure this doesn't happen again?
Dr. Fitzgerald?
I think right now what we're seeing, our initial investigation, or at least at Eastern Health, we're certainly seeing spread not just within the school, but in social activities as well, through sporting events and through other social activities. So certainly we're seeing a lot of spread in those situations. This variant certainly does change the way we look at things, and we are looking at all of that right now as we look to, how we move out of level 5.
Thanks.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. All Newfoundland and Labrador has been told the reason behind the delay at the whole genome sequencing lab is that the results from the test have to be confirmed against the National Microbiology Lab results, which is similar to what we did with the initial COVID test back in March. So I'm curious, when is that process expected to wrap up?
Minister, that's probably best directed towards you with respect to laboratories.
Yeah, certainly. That's a very good question, Elizabeth. I will check into the substance and answer to your question. I do not have it currently.
All right, thank you. And I guess this might be a question I have to email to get an answer on, but it kind of follows up on that. Can you talk a bit about the layers of validation and verification this lab does have to go through?
Again, sorry, there's a bit of a lag on Skype. I would try and include that in the answer to your question, although I think that may take a little bit longer.
All right, then. Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. And this information might come out in the news release that generally follows this. But in regards to the latest COVID-related death in the province, are we able to know the age range, gender, and if there was any underlying health conditions with this individual?
So as I've said many times before, I can't really speak to, individuals because of privacy issues. And to be honest with you, the information I don't have right now. No.
Okay, no worries. I also have a question in regards to a letter that was published and issued yesterday by the College of Physicians to its members. They received, and it reads, they received several concerns from patients and physicians about the use of virtual care to the exclusion of personal examination. This includes physicians providing virtual care only, no office visits, to failing to examine a patient appropriately, leading to poor patient outcomes. Now, both doctors and patients are complaining to the college about this. What is the plan to alleviate this problem? Minister, I don't know if you're best suited for this.
Certainly. We have a system in place for supplying even private clinics and physicians with PPE. We have made it quite plain that the decision as to whether or not a virtual consultation or a screen before a physical examination is up to the physician as to whether or not which route they choose. I think these complaints are properly addressed to the college. It is a clinical practice issue and therefore not something about which government or the health authorities can mandate anything different. That's a college issue and it lies most properly with them. I would certainly encourage all physicians who feel that they have barriers to seeing patients to bring those forward to their local RHA and if need be to the department, because I've not been made aware of any.
Kellyanne, I can certainly empathize with physicians having practiced in the previous lockdown that it isn't always easy. Everybody's practice is a bit different. Of course, you got specialists who differ even within the specialty, and then family practitioners and primary caregivers trying to navigate this. So I can empathize with where physicians and patients alike are in trying to make that crucial decision whether a virtual consultation is appropriate or a in-person consultation is required. And certainly, as the minister suggested, if there are barriers to in-person consultations, please reach out to us so that we can try to eliminate those, because sometimes you absolutely do need to see the patient to do the appropriate assessment. And sometimes, a virtual clinic visit is just one tool that we're using and hopefully we'll use forever now, but during this pandemic, but sometimes you still do need that physical examination. And so if there's anyone out there who has barriers, physicians or patients alike, please, as Minister Haggie suggested, reach out to your regional health authorities, or if you have no luck there, please reach out to the department directly.
Thank you.
Our next questions are from Andrew Robinson with The Telegram. Please go ahead.
Good afternoon. I'm wondering whether anyone could speak to awareness on the prevalence of issues of lost specimens or test results. Our newsroom is aware of at least one case of a person tested 7 days ago after developing symptoms, kept checking back through 811 with no result, and then finally through 811 today, they've learned that their test their specimen still has not been received, and they've been told now to get a new test. So they're now going to continue to await a new test result after having already used a considerable amount of sick days and vacation time to deal with that.
I'm not aware of any specific instances of lost specimen. Certainly happy to look into that with public health and the public health mechanism and the laboratory to see if they have any information we can provide. But I do know that there were a significant number of individuals in the height of the kind of bulge of testing whose contact information was inaccurate and who had to reschedule or call in again to provide the appropriate contact information. But that's not quite the same. So I'm not aware of any through our reporting mechanism from the laboratory is the short answer.
Just to follow up, too, I've heard tell of multiple health regions in the province having to deal with now redeploying staff to different areas or staff being told to get ready to be redeployed, whether it's for testing or to move on to a hospital in order to deal with staffing challenges. I know Mr. Haggie referred earlier to the number of isolated healthcare workers, coming down, I believe, to about 312. Are there still challenges, though, in addressing staffing at facilities and to deal with the needs of testing?
Certainly from the testing point of view, the numbers have dropped off significantly over the last couple of days. I think we're just below 700 in the last 24 hours, although the release will have that figure more accurately for you. In terms of redeploying staff, that's very much an operational question. I could certainly go back to the regional health authorities and inquire specifically about that. But I haven't heard of any kind of suggestion of mass migration of staff across the province or between facilities. But there is a background level of activity that happens because of staffing challenges anyway within regional health authorities. They do have a pool of mobile staff in some areas. So I don't have any more information than that at the moment, but I can certainly go back to CEOs and ask for some clarification for you.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hello, everyone. My question is more about clarification on what causes the increased degree of transmissibility. So obviously I don't have the level of education or experience or research. It seems to me from what I do know that it's not so much about how it travels from one person to another. So if you cough or sneeze, the droplets don't get better air time, and it doesn't necessarily penetrate masks with any extra aggression or isn't necessarily believed to stay on surfaces longer, which means, luckily for us, that keeping your hands clean, wearing your masks, washing commonly used surfaces, and keeping your 6 feet distance does just as good a job of preventing us from exposure than the original strain of the virus would. Is this accurate?
Yes. So the reason that the virus is more transmissible has to do with the way that it has a mutation that allows it to attach and enter cells more easily. And so
post-exposure.
After someone's been exposed, yes. So while, no, the viruses don't spread through the air more easily, if you come in contact with these virus particles and they get into your nose or your mouth or your eyes, then, they are more easily able to set up shop and cause an infection than the previous version of this virus would have been able to do. So because of that, they're much more easily transmissible, and so we see a lot more people get infected from one infected person.
You can think of the virus as being more armed, Jason? It's more, more armed and ready, yeah.
So knowing that our preventative measures pre-exposure are just as effective now, if businesses are willing to adhere to those standards with the utmost stringency, like we may have done before, are we not closer to understanding that we can maybe open up shop for the next level of business?
So certainly we're looking at, there's more than just how transmissible the virus is or how the virus behaves that determines whether we can open up. So it has to do with our epidemiology, how much do we see circulating, how many unlinked chains of transmission do we have, do we think there's still more out there that we've just not discovered yet, are we going to see another big surge in 2 weeks' time? Like, those are all the questions that we have to be looking at with the information that we have. So, it's more than just how the virus works and how we can prevent it.
Okay, I appreciate it. Thank you for the clarification.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Dr. Fitzgerald, I have a process question. In arriving at the decisions for who's involved in phase 2 of the vaccine rollout, is that a decision that you reach in isolation, or do you consult with Dr. Haggie? In the end, I presume it's your responsibility to decide what the phase 2 is, or maybe I don't understand that the responsibility is shared. Can you kind of explain how that decision gets made?
So there's a huge body of evidence, and there is a national committee. So it's the National Advisory Committee on Immunization, or NACI as we call it, that gives us all advice across the country on who they recommend should be in the priority groups and the order in which priority groups should be addressed. That's based on evidence, that's based on epidemiology. There's a lot of things that they consider to make those decisions. There's discussions that are had at those tables across the country, like the Special Advisory Committee. We have conversations about all of this. It's basically a conversation that we're having right now 3 times a week, probably. These are not decisions that are made in isolation for me here at the province, but they're also not made in isolation for the province and the country. We're making all of those decisions together and trying to be as consistent as we can. However, we have to take into account that there are local factors and local issues that may change exactly how one province has to do it compared to another. But there's certainly a lot of guidance that happens. So we take our lead from NACI and those FPT tables, and then the people here at the department will develop a plan based on that and looking at our own local context, and that gets discussed in a few different venues, and then our recommendations are made. So.
And Roger, of course, there is the local vaccination team, that working group kind of that Dr. Fitzgerald and Minister Haggie have been leading since December, I believe. Was it Dr. Fitzgerald, somewhere around there?
Somewhere around there. I don't know. Time is
so
fleeting.
Not in isolation, not just to reiterate that the local lens is used here as well with respect to the epidemiology and the differences of geography, et cetera, here.
Okay, I presume that there was some role that Dr. Haggie played in it, that the government's involved in arriving at whatever decision it's arrived at. Which brings me to a question about the caretaker convention, where government's supposed to be operating with restraint, and specifically in contracts. It seems to me that making a decision about phase 2 is kind of like a contract, because whoever forms the next government is going to be bound by that decision. So I guess the question would be for you, Premier Fury, do you think it would be appropriate to seek the view of the opposition, if not their agreement to whatever phase 2 plan is going to be rolled out on Friday?
Well, as Dr. Fitzgerald has said, she's following all the kind of national guidelines in this. There is no political lens on this. This is one that'll be purely scientifically driven and evidence-based, with Dr. Fitzgerald, her team, and the advice from across the country, looking at other jurisdictions. But I think people are anxious and they want to see what phase 2 will look like, and so I have every faith in Dr. Fitzgerald and her team to provide the right direction.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. My first question, I guess this could be either for Dr. Haggie or Dr. Fitzgerald. Just on vaccination of frontline healthcare workers, how many people working? I guess my first question is: everybody working directly with a hospitalized COVID patient, are they all considered Tier 1 healthcare workers? Will they all be vaccinated between now and March 5th?
Yes.
They will. Okay. And once we go past Tier 1, how many healthcare workers are we talking about?
In terms of the denominator, I would actually have to look at those that the RHAs have provided. Basically, what happened was to identify the distribution pattern for the vaccine. My understanding was Public Health Vaccine Depot provincially went out to each regional health authority to ask them to identify numbers and roles of people who would fall into the essential Tier 1 group, and then those that would be regarded as frontline, and then those that would be regarded as at lesser risk. I would actually not have those numbers to hand. I don't know if Dr. Fitzgerald does, but we can endeavour to find those for you out of the total employed in healthcare in general.
Thank
No,
you.
I don't have
And
that.
are all the healthcare workers working
No,
in the COVID unit?
you've had two questions, Patrick. We'll come around, though, on another round. You can get a question in. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. RMC on the West Coast have said that they're investigating numerous reports of people not following special measures orders. Dr. Fitzgerald, how concerning is it for you to hear about this, and what's your message to people who now still, over 10 days in, are throwing rules to the wayside?
So, it is concerning that people, may not believe that the risk is what it is. And I think, certainly there's a process in place if people aren't following the rules, and I think that process has to be followed. But I would urge everybody to think about what we're doing here, what we're trying to do. We're trying to make sure that people stay safe. We want to keep people from getting sick with COVID, from staying at a hospital. So it's really important for people to follow those recommendations and make sure you keep your bubble as small as you can, and keep your contacts as low as possible, and make sure you're wearing your mask and keeping your distance, and all those things that we've been recommending at level 5.
And I've received a couple questions regarding Indigenous seniors who are living in more urbanized areas such as St. John's. Where do they fall in the vaccine rollout, and how are we ensuring proper access for them?
So certainly, as with the NACI guidelines, those people are recognized in phase 2 or stage 2 of the NACI guidelines, and certainly that's we're taking that strongly into consideration, and we'll have more information on Friday when our plan rolls out. And we do have outreach in those communities, so we are able to make those connections when we need to.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question for the Premier about vaccination statistics. Using the statistics that the government has put online, it shows that two-thirds of the doses that have been shipped to us have been used. That still means that there's a third of the doses sitting in freezers. Even once you take out the second doses that we still need for people who've already gotten their first, there's still thousands of vaccines that are still sitting there. When you look at that record, we are the second lowest in the country out of the provinces, and it's consistently been that even through previous snapshots. So where is the bottleneck here? Why is our record so much worse than other provinces? For example, Saskatchewan has delivered more than 100% of the doses that they've been shipped.
Well, I think that goes to Minister Haggie's opening remarks about when vaccines actually arrive and the lag time between distribution and actually when they arrive on the island. I mean, Minister Haggie, you want to weigh in with the numbers that you had here at the beginning of the opening, just to refresh for Peter?
Certainly. We have 5,850 vaccine doses, according to Peter's calculation, that are unaccounted for. They are currently being administered or in transit to more rural and isolated places. They're going down Burin and St. Lawrence. They're going down Bonavista. and long-term care facilities down there. The reconciliation process takes a little bit longer because initially it's paper-based before it's entered into the electronics. And that's the reason why the website is updated on a weekly basis. I could easily make those figures look so much better by updating them 24 hours earlier before the shipment arrives. But we've chosen that date, and we will live with it. And you will see that permanent difference built in. Because the challenge you're talking about is the fact that we are a territory once you get past the overpass. Our population density is the same as none of it and should be considered in that light, I think, quite frankly. But the issue is simply that we are in the process of delivering those vaccines and administering them. And whilst that process is fairly rapid, the reconciliation to adjust the numbers takes days.
And a follow-up question for Dr. Fitzgerald about measures. Even with the surveillance, rapid testing that we've seen in Central, Western, and Labrador, we haven't seen any new cases aside from the travel-related ones. We're hearing from a lot of business owners who are getting frustrated about the fact that they're shut down despite the fact that there's no evidence that there's COVID in their communities. How soon might we see restrictions change for areas that currently aren't seeing an outbreak of COVID?
So as we said, we would reassess things at 2 weeks. So Friday, we should have some updates on that. So hopefully we'll be able to let people know what the plans are after that. But, you know, we do have to remember that we shut things down. We had a variant that was quite contagious. We were seeing quite significant spread here in the metro area. Had we not done what we did, we might be seeing a very different situation across the island right now. So, and this is the paradox of public health. When we do things and they work, people think we didn't need them. But I would caution people against that line of thinking because we have no idea what would have happened had these measures not been put in place.
Thanks.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. With the upcoming vaccine phase rollout coming Friday, I'm wondering if the province ever ended up hiring someone to oversee vaccine rollout like Ontario did with retired General Nick Hillier, or was it ultimately done by the local vaccine committee?
It was ultimately the vaccine committee, including, of course, the leadership, which is paramount, of Dr. Fitzgerald and her team. So it was a committee of volunteers, including like Dr. Natalie Bridger and others, some government officials, department officials on that team.
Thank you. And when the province eventually leaves Alert Level 5, we're going to get there eventually. I'm curious, is it possible there will be some permanent changes to the alert levels, given how we know how these variants can so easily spread?
Certainly that is something we're looking at right now, and once we have a look at all of the information and all of the data, you know, all those questions are on the table, and we have to think about how we do things going forward, for sure.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, you noted that you're looking at changes for the schools because the variant has been a game changer. Right now, the latest we had heard was February 26th was the timeline given for at-home learning or online learning. Are we looking at an extension past that?
So, as I said, we'll have some updates on Friday. I don't think it really would be prudent for me to speak before I have a chance to look at all the information. So I'd rather not make any predictions at this point.
No worries. And Minister, just to touch on the virtual care issue that I previously had brought up, the fee for service for virtual care is slightly more lucrative for physicians than face-to-face visits, regardless of PPE. What incentive is there for primary care physicians to open their office to in-person visits when they can do virtual care instead? Patients are complaining they're getting substandard service in many cases, as documented in the letter to physicians. With the province paying for this fee, this is a province decision on some level. So what can be done here?
Oh, you're on mute,
Minister, you're on mute.
Sorry, technology. we're currently in negotiations with the Medical Association over their new contract, so that's all on hold at the moment. This was simply a restitution of a fee from, or an introduction of a fee from the last go-round, as it were, in March or May. The issue around what kind of consultation is necessary is a clinical one. The investigation of those complaints and those kind of things rests firmly with the college. It's not a departmental issue. And I would trust in their good judgment, which they've exercised in the past. I sympathize. I'm not aware of any barriers to any physician who wishes to, be they in a regional health authority facility or in a private office. I'm not aware of any barriers for them to do face-to-face consultations if they feel that's necessary. And indeed, Dr. Fitzgerald's special measures orders specifically allow for that, even under Alert Level 5.
Thank you.
Our next questions are from Andrew Robinson with The Telegram. Please go ahead.
Thank you. I know when we were kind of, in particular, in the thick of it with testing following the spread of the new variant and the uptick in caseloads, there was upwards of 3,000 test results coming in daily. As the number of new confirmed cases has started to lessen, so too has obviously the number of tests happening. I wonder, is there any concern about whether we are for sure catching all of the new confirmed cases that are potentially out there?
Oh, that's always a concern. No doubt about that. So that's why it's really important, if anybody has one symptom, that they go and get tested. That's part of the reason why we changed our symptom criteria, is because we wanted to make sure that we were catching everybody who potentially has this virus, because we know a lot of them can have very mild symptoms. So absolutely, if anyone has symptoms, they should go online and fill out the assessment and referral tool. We have seen a lot of those tests that came when we were doing those large numbers, in the run of a day, came as a result of contact tracing, as a result of advisories and that sort of thing. So we would expect to see more testing in those situations because we have more people that we needed to test, in addition to all the people who had symptoms, right? So it's not unexpected that we would see more at those times. And people have been home now for almost a couple of weeks and have been staying inside, so we were seeing fewer people who are being the subject of advisories and fewer advisories in general. Eastern Health has done an amazing job at working through all those contacts, and so a lot of those people have already been tested. People are staying apart, and when we stay apart, we tend not to spread any viruses, so people don't have a lot of symptoms either. So there are reasons why our testing numbers would be going down that are perfectly acceptable and fine, but at the same time, I would caution people not assuming that your stuffy, runny nose or sore throat is just a cold. You should get tested.
I wonder, too, whether there's any thought being given to widening the scope of testing availability, possibly, for example, people who voluntarily want to get tested even though they're asymptomatic.
So we do have to be careful when we do testing. Again, as I said, there is that false negative, false positive rate that we have to be concerned about. So at the moment, that's not in our plan, but, we have done pop-up testing in other places across the island, and we're still looking at those options with regard to our testing strategy going forward.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hello. I asked previously, looking for details or, to identify the concepts of exempt or essential workers who can go straight to work and only self-isolate after work. And I know you're particularly protective of the privacy of individuals, and I think not just myself but the whole province commends you on that. However, I'm wondering if you can please give us an idea of what types of situations fit into the blanket statement that a case is travel-related. Like, is that rotational work? Is it a pilot who's here for a night on Tinder? Is it someone that came home to visit Nan? Are all of these things travel-related?
So travel-related basically applies to anyone who traveled into the province from anywhere else in the world and became symptomatic during their quarantine period or were tested during their quarantine period and found to be positive. We would call that travel related. It's as far as so far, that's served us well. So, but yeah, it's basically anyone who's come in from outside the province who has been diagnosed with COVID in those 2 weeks in isolation.
Okay, thanks for the clarification. Just as a little bit of a follow-up, do you feel as though the nature of where those travel-related cases came from, like if more than a half are from one particular type of travel, is that something that you feel as though the province, as members of Newfoundland and Labrador, have not necessarily a right to know, but do you feel like it benefits us to know that, or would it just cause backlash against an industry?
We try to maintain privacy as much as possible. We've always said, though, if there's a need from a public safety point of view that certain information has to be known, then it will be known. And that's basically where we come down on things. Does knowing this information benefit the public? Does it improve public safety? If so, we have to release it. If not, we don't.
Okay, perfect. Wonderful. We're not at any extra risk. Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Premier Fury, I know the pandemic committee that was established by then Premier Ball continues to meet. Though the PC and the NDP parties both say there isn't much of a dialogue. It's more of a forum where they're given information updates and advised about decisions. Has the phase 2 rollout been on the agenda of the pandemic committee yet?
I believe it's been, it's brought up as to when phase 2 is coming, but again, I have no visibility into the parameter, into what actually phase 2 is. I trust Dr. Fitzgerald and her team that they'll follow the evidence and the guidance of the national bodies to ensure that our phase 2 here reflects the evidence across the country, and in particular as it's applied to the geography of Newfoundland and Labrador.
I don't understand. You're saying that you haven't got any input into the makeup of phase 2, or Dr. Hagg hasn't had any input into the makeup of the phase 2 rollout?
I have not. No, I have not. No.
Dr. Hagg.
Could I just jump? Yeah, I'd be happy to jump in here. I think I'd have to refer you, Roger, to the Public Health Promotion Act, which states quite clearly, under the circumstances of a medical public health state of emergency, authority about these decisions is vested solely in the Chief Medical Officer of Health. We are unique in this country with having that legislation, and I would argue that has served us extremely well. The only way a politician could change Dr. Fitzgerald's view or decision would be to convene the House, which we can't because there's no MHAs just at the moment, and also amend the Act and essentially remove her ability to make special measures orders. If they want to go down that road, then that's theirs. And this is the most political I've been, and I don't wish to belabor the point that the authority for these decisions under a public health state of emergency is the Chief Medical Officer of Health, not mine, not the Premier.
Yeah, I wasn't asking who had the final authority. I was asking whether you had any, was there a dialogue? Have you been involved in the dialogue?
Oh, yes. I have.
That's what I was asking. If you've been involved in the
my
dialogue...
apologies, I misheard the question. I misheard the question.
I don't mean to sound argumentative, Dr. Hagg, not at all. I'm just trying to understand the process, and if if there's a dialogue that's going on involving you, has also extended to the pandemic committee and the opposition members?
We have discussed at that committee on a regular basis where various workers or groups of workers might fit, and that has been fed back to the vaccine team writ large, which has really been somewhat in abeyance because of the caretaker convention. But the decisions around the public health executive team, those individuals are aware of comments from the independent member, both members of the NDP and both members of the PC party who sit on that committee. So sorry if I wasn't clear about that, but yes.
Oh, maybe I wasn't clear either, but I think I've used up my 2 questions.
All right.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. Are all healthcare workers that are or who may come in contact with COVID patients in the COVID unit or in the COVID overflow unit at the health science, are they currently vaccinated? And if not, how many of those workers remain to be vaccinated?
Dr. Hagen,
My understanding is that they all have. Sorry, I see Janice taking a mask off. I don't want to jump over her comments. My understanding is that has happened. It is the rural areas of Eastern Health where people who might come into contact with COVID are still currently being vaccinated. Sorry, Janice.
No, that's fine.
Okay, and my second question is for the Premier. Premier, you've said repeatedly that reporters should not ask political questions at these health briefings, but you've been unavailable to media for the past 2 days. I'm just curious, when and how are we supposed to ask you about the election and other important issues if we can't set up an interview with you?
No, I understand, and we were going to have an media availability this morning, but given the news of a death in the province from COVID-19, we felt it was inappropriate and recognizing the sensitivities around that. So there will be one tomorrow.
I will now go back through each reporter to see if you have one final question. Richard Duggan with VOCM, do you have a final question?
Yes. Are we still making use of the rapid tests at this point? And if so, do we have any numbers related to how many we're going through?
As I will have to get that information for you, Richard. My understanding is that there is some rapid testing being done. I'm just not sure how much at the moment.
Okay, thank you.
Peter Cowan with CBC, do you have a final question?
I do, Leslie. A question for Dr. Fitzgerald. I just want to go back to the question around schools. The fact that there are around a dozen staff members that have contracted COVID from Mount Pearl Senior High. You said a lot of the transmission was around outside gatherings and social activities. But what does it say that so many staff have tested positive when I can assure you they would not have been invited to the party?
Yeah, so a lot of them are parents, and so they might have gotten it that way. And some may have gotten it through the school. We haven't teased out all of the that epidemiology. It's been a lot of work for Eastern Health just doing the test, trace, and isolate at this point, and that contact tracing follow-up. So as they sit down now, as things are slowing and they get to sit down and really look at these numbers and dig deep into that, we'll have a better story about what that, what the transmission looked like, what the epidemiology looked like, and hopefully soon I'll be able to tell that story.
Great, thanks.
Elizabeth Whitten with All Newfoundland Labrador, do you have a final question?
Yes, I do. Cases have been declining steadily this past week. Dr. Fitzgerald, is this what you were hoping to see this far into level 5?
Yes, so we knew that things weren't going to happen immediately. I know initially we had seen, after the first few days we saw those fairly impressive drops, but we knew that wasn't going to last. Some of that had to do with the way that our testing was being sent out, and so we just weren't getting those results really quickly like we were the other results. So we knew it was going to take at least this long. When we looked at calls cluster last year, it took about a month for Eastern Health to be able to find everyone that was related to that and to get that under control and for the numbers to come back down. So I think the fact that we're seeing this steady reduction in numbers about 2 weeks out, I think that's quite impressive. and just a testament to the amount of work that Eastern Health has done, and a testament to the effectiveness of, lockdown measures. So I think what we're seeing now is what we had hoped for. I don't know if it was necessarily what we expected, but it was certainly what we'd hoped for.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
I do. It's in regard to hospitalization. Dr. Fitzgerald, I've heard from healthcare workers across the country that it's not necessarily the new cases that have to be we need to concern ourselves with the most, but it's those that end up hospitalized, because that's the system we end up relying on for life-saving procedures. But in regards to that, when you see the increase happening, typically it's standard 10 to 12 days outside of an outbreak. Should we anticipate to see more hospitalizations? How concerned should we be for the healthcare system as we see that number grow?
So, we know with this disease that there are certain percentages that will be hospitalized. Certain percentage with severe disease will end up in ICU. And unfortunately, there will be a certain percentage of deaths that are associated with that. That's been pretty standard throughout this whole pandemic. There are some reports that this variant may actually lead to more severe disease and potentially deaths as related to this variant. But, that information is relatively new. We did have a lot of young people proportionately in this outbreak, so that certainly I think will play some influences to the number of hospitalizations and severe disease that we see. But, the expectation would be that we'll see, based on our numbers, we may see anywhere from 10 to 20, and I guess that's what we have to be looking out for. But I think our system will be able to handle that.
Thank you.
Andrew Robinson with The Telegram. Do you have any final questions?
A follow-up to what Richard Duggan from VOCM brought up earlier regarding the situation with enforcement in West Coast with the RNC. I wonder whether any thought has been given to whether there are additional measures that can be brought in to help aid enforcement, whether that be further restrictions, harsher penalties, or more public education to aid enforcement.
So I think the penalties are the penalties unless, the legislation changes. But, I think the amount of education that we've done is certainly quite significant at this point. So, I think people know what they have to do. I don't know that there's a lot more that we can say. Unfortunately, there are some people who are either feel they don't need to follow the rules or don't have to, or perhaps there are some who are not aware. But, I think for the most part, there's a lot been done already that to help people understand what needs to be done.
Jason Piercy with Rogers Communications. Do you have a final question?
Yes, I do. Well, sort of anyway. I asked, I guess it was last week, about critical developmental periods and potential time missed for our children. At the time, there wasn't any definitive answer, and I've been fortunate enough since then to speak to two specialists in the field, and all research suggests that we're all going to be just fine. And I didn't think that it would be fair of me not to take this opportunity to spread that good news, so I'm very sorry for hijacking, but that's all that I have to say.
Thank you, Jason.
Thank you, Jason.
Roger Bill with the Shoreline News. Do you have a final question?
Yes, I do, for Dr. Fitzgerald, and it's a question that was raised by a reader of the Shoreline News. This man has a mother who lives in a personal care home, not a nursing home, but a personal care home. And he wants her to wear a mask. She says, however, she's the only person who does. This gentleman is curious, why aren't residents of personal care homes required to wear masks?
So people who live in personal care homes, certainly that's their home, and so we don't ask people to wear a mask in their homes, and we reduce the risk as much as possible. Certainly we know that people who, the biggest risk for people in personal care homes are people bringing the virus in. So that's why we ask visitors to mask, we ask staff members to mask. So we do reduce the risk as much as we can, but we don't ask people to mask in their homes.
Thank you. I'm sure you'll appreciate the answer.
Patrick Butler with Radio Canada. Do you have a final question?
I do. Dr. Fitzgerald, over 2 weeks ago, you announced the 2-week circuit breaker. How much longer will the circuit breaker last? And as we ease out of alert level 5, whenever that does happen, are we looking at sort of these 28-day steps from one phase to another like we saw last time?
So I think the circuit breaker was overruled by alert level 5. So we said 2 weeks from for alert level 5. So that was 2 weeks from, 2 Fridays ago. So this Friday will be 2 weeks, and we'll have some further information at that time. With regard to how quickly we move out of alert levels, I think those are conversations that we're having right now, and we'll have more of an update on Friday about that.
Thank you.
Thank you, everyone. Premier, do you have any final comments today?
Well, thank you, everyone, for joining. First and foremost, my thoughts, prayers, and condolences are with the family of the loved one who's passed as they grieve in this different time. Please know that myself, Dr. Fitzgerald, and Dr. Haggie are all, and of course the entire province, are grieving with you. With the new vaccine inbound, with new vaccine numbers inbound for Newfoundland and Labrador, we are hard at work to figure out the next phase of the vaccine delivery. And this will prove to be the best tool in preventing any more deaths related to the virus and its variants. But till then, we need to continue to follow strict public health guidance, to follow Dr. Fitzgerald and her team, to ensure that we are, if you're at home, stay at home unless you absolutely have to leave. And till then, we'll leave it at that for today. So thanks very much, Newfoundland and Labrador, and please stay safe.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.